or your patient who already has problems with the trachea and you want something that's going to have less pressure against the tracheal wall. Usually they can be on a ventilator with this, but usually this is your patient who's already like on a trach collar or something that you're going to use the Bavona on.
Is this for like a monster trachea?
No, that's normal. This was a pediatric one actually. That's a normal size one.
God, that looks so big.
Yeah, I can't deflate it because the plastic has been ripped off.
But it even looks so much larger than the cup on the other ones.
Remember, when you're talking about cuffs, you're talking about high volume, low pressure. So by having the cup this size, this way, you're not applying a lot of pressure on one area of the trachea. It's spread out over a larger area, so you're not going to be putting as much pressure against one part of the tracheal wall.
Makes sense.
Make sense? Okay. A lot of times you will have the nurses ask you, oh, this thing is open, and they want, for some reason, they always want you to close it. But no, you need to leave this open because that's what keeping this inflated.
So if you close it, it won't keep it inflated?
A lot of times you'll lose some of the air in there.
Oh, is that the Bavona?
That's the Bavona.
Because it relies on the atmospheric pressure.
Exactly. That's why you have to leave it
So
open.
when you put it in, it has to be deflated.
Nurses
Right.
like
I'm
you
sorry, I
use
didn't
it
hear
for
that.
infection.
Yeah.
She has to,
I didn't hear what
They
she
don't want
if
said.
you
it
put it in,
into
it has to be deflated.
Yeah, before it's inserted, you have to make sure that you get you see how it shrivels up when you deflate it? You have to make sure it's completely deflated. And then once it's in place, you simply take the syringe off and
if
it,
you close the end, will it deflate?
She said slowly.
You'll lose some
Oh,
air.
slowly over time.
right.
And in fact, in the brand new one, you'll see there's a label that says, "Do not leave syringe
Oh,
on
yeah.
port." So it's a warning, put it on there. And I have to let you know that at Central State, we had an argument with the thoracic surgeon who insisted that you put air into that cuff.
A thoracic surgeon.
Mm-hmm.
He wanted you to put air in here.
She did.
Sorry.
And I don't know, she was confused. But
She was confused.
that's what's special about the Bavona, that it's atmospheric pressure that inflates the cuff.
She was a little confused, that's all.
They're expensive, right?
They're all, medical equipment's expensive. We use it in special circumstances when you can't keep a good seal, when there's maybe erosion going on with the mucosal wall, all kinds of different.
It could be the better one.
They use Bavona
I'd love to see that with an ET tube.
See what, a Bavona? I mean, a
Kind of
cuff?
a cuff on the ET tube.
What?
That's a foam cuff.
Why?
It just seems like it would make sense.
Remember,
for
most
it
of your
to be in
people
place long enough to
Most of
really
your
have-
people who have an ET
Softer.
tube require a little, because they're on mechanical ventilation.
It wouldn't